I'm Chris Luscombe. I currently work in Grand Falls, Windsor as a rural psychiatrist. I guess over the past week I've been trying to prepare my thoughts for today, and it's been a real struggle for me to determine what I was going to discuss here in the presence of you. The issue for me that's been a struggle is that I'm not here speaking for myself. I'm here speaking on behalf of thousands of Newfoundlanders who are currently waiting to access mental health services. And in particular, I'm speaking on behalf of my rural friends and family, and I am a rural Newfoundlander. And this group has no voice, so I feel some responsibility to try and give them a voice today, and I hope that I can convey their needs in a meaningful way to you this morning. If you wait too long in an emergency department, or you're on a wait list for surgery, you can go to the media. Your family can go and advocate on your behalf. If you suffer from mental illness, or are the family member of a loved one who suffers from a mental illness, you will suffer in silence. It's very easy for us in this province to believe there is no problem because nobody's complaining. My job as a psychiatrist is to diagnose and treat mental illness. It's also to manage risk and prevent injury and disability. Because all rural psychiatry positions represent about 50% vacancy, so half of the rural psychiatry jobs are currently vacant, I feel like this is very much an impossible job. The focus often then becomes, as my colleagues have highlighted, on the most severe cases. And I would compare my job to operating a rescue boat circling a sinking passenger ship in the North Atlantic. I'm there, my job is to help. I see people on the sinking ship, I see people in the freezing water, and I see people drowning. And I have very little help. So my job tends to be helping those that are drowning. And it is very dissatisfying to know that with a little bit of help, maybe we could focus on taking people off the boat before they fell into the ocean. You might think I'm exaggerating the problem, because again, very few people are speaking. You do not see what I see. I do compliment the media, because I have seen at times rare opportunities when people do bring their stories forward to us and share with us their pain despite the stigma that tries to hold them back. I think about people like Vince Withers, who after losing his daughter Renata to an eating disorder has started a foundation and an initiative for education and treatment of people with eating disorders. That is one small glimpse of the need that we have. If you want to see the problem and the needs better, you need to look the way that I can look. If you see an anxious child, as Dr. St. John has spoken about, the child doesn't fit in, their behavior is not acceptable, we recognize as physicians this is an illness and a child with needs. With appropriate care and intervention, the story stops there. Unfortunately, if they cannot access services such as Dr. St. John offers, then people see the child as a nuisance. They don't see him as sick. The child now, their illness progresses, they're suffering more, they're looking for ways to cope. Unfortunately, in our province, I would make the argument in some places it's easier to access OxyContin than it is to access psychotherapy. You can see how this story can end in a headline. And when I watch the news, these are the things that go through my mind when I see people with criminal activity and suffering. Is this a failure of health care? For me, OxyContin addiction is very quickly becoming an indicator, I believe, of a lot of untreated depression and hardship in our province. It has very much overtaken my practice and is quickly filling my rural inpatient unit. The illnesses that I see every day are malignant. At the early stages, it may just affect things like sleep, then ability to cope with stress, then it begins to affect function at activities such as school and work. This is the time when our interventions can be very successful. Later, there is severe suffering, disability, and then the losses start piling up. We can quickly and easily see how a person can become desperate. Desperate people do desperate things. And our society suffers as this causes family breakdown, bankruptcy, addiction, gambling, criminal activity, and unfortunately suicide. Physician resources to treat mental illness in rural Newfoundland, they're poorly organized and they're profoundly under-resourced. In my area, central Newfoundland, it is estimated that 20,000 to 30,000 people will suffer from some form of psychiatric illness at some time in their life. As I mentioned before, we have 50% of our positions are vacant. And we also struggle with the fact that colleagues are approaching retirement. In my community of Grand Falls, Windsor, we have not recruited a single psychiatrist in 4 years. And this is a town that has fortunately had some success with recruitment in other disciplines, and family medicine in particular. When I speak to people, and we try to engage people for recruitment, they talk about the heavy workload, they recognize the severity of the illnesses that we face, they recognize the risk a physician puts themselves in to be caring for such high-risk patients constantly. They also identify the lack of support services, and often they will go establish practices elsewhere. In rural Newfoundland, it's virtually impossible to even locate temporary or locum physicians to cover a weekend, as the job is so busy and undesirable. And then we have places like Labrador that have no psychiatrists. The people I serve and care for struggle not only with their illness, but must deal also with ignorance and stigma. As I said, their silence makes them easy to ignore. But I want you to understand that, contrary to popular belief, my patients are your friends, they're your neighbors, and your family members. There's nobody in this room or in this province who hasn't been directly affected by a person with a mental illness. They come from every walk of life and represent the backbone of our economy and society. My patients are doctors, they are fishermen, they are teachers, and they are trades workers. Without a voice, without advocates, these tens of thousands of Newfoundlanders suffer every day, and they wait, and they wait, and they wait for necessary health care. Of the 10 most disabling illnesses in Western society, the top 2 are depression and alcoholism. In fact, 6 of the top 10 disabling illnesses are psychiatric illnesses, including bipolar disorder, schizophrenia, OCD, and dementia such as Alzheimer's disease. The waitlist to see a rural psychiatrist is among the longest waitlists to access a health service in Canada. To access me can take over 2 years. This is clearly an inadequate service for such a serious and prevalent disabling condition. There has been progress in recent years in advancing mental health services in our province. We've had establishment of new mental health legislation. We've had improvement in addictions rehabilitation services. There's been development of teams of allied workers to better respond to community crises in severely ill patients. I see this as building a hospital without doctors. These services need to be complemented and supported by physicians. Solutions to mental health care needs, as I've identified, will partially lie in increasing the number of psychiatrists in the province, but also increasing the support for family physicians, emergency departments, these other providers who provide a considerable amount of mental health care. Our system does not recognize the value and coordination of the value of coordinated services. And one of the major problems is that our system is so fragmented and disorganized. I spend a considerable amount of my time, as do my family physician colleagues, in trying to navigate this system in terms of trying to support people who are waiting. Volunteerism is the word I would use for that activity, because this is an outdated system and it doesn't provide them with the resources or time to be able to coordinate care and to be able to link people into appropriate services, and therefore there's no timely mental health care.